Hello everyone, I'm Dr. Deepthi Bawa. I'm the Chief Consultant in IVF and Reproductive Medicine in SPARSH Hospitals, Bangalore. Today in this episode, I'm going to introduce Dr. Joshua Peter. He is our senior-most embryologist and senior-most person in this field who has helped us achieve a lot of babies in the field of IVF. Welcome to you, sir.
Thank you very much.
Understand how the embryos, from embryologist's point of view, why there is recurrent implantation failure, sir.
What happens in a normal situation where any embryo, pregnant woman, when they get conceived, in normal circumstances, the success rate of implantation is only about 30%. That is a natural fecundity. That is what happens in nature only. So 70% of the embryos do not implant for a simple reason. Most of these embryos will carry a chromosomal abnormality called aneuploidy. So that being the case, the success rate is only 30%, even in a normal situation where husband and wife meet for the first time and conceive and the embryos develop. That's why when you see a married couple, when they get pregnant, it's not the first time that they get pregnant soon after they get married. It takes several months or whatever, even a year, for them to get conceived because of the implantation failure because of chromosomal abnormality.
So you mean to say that most of the time it is the aneuploidy embryos that gives us poor results.
Exactly.
So how can we, now we have something called as PGD.
Yeah.
And does that help us in improving the success rates?
Yeah, it is quite possible that we can check all these chromosomal aberrations in an embryo on day 5 when we take a biopsy of the embryo, one of the blastome years, and check for chromosomal abnormality. There is what is known as FISH technique, fluorescent in situ hybridization technique, where the embryo can be detected under fluorescent microscopy aneuploidy. That means the number of chromosomes where we can analyze is about only 5. That is 13, 15, 21 trisomy, 13, 15 trisomy, and X and Y chromosomes. So these are the only probes available for chromosomal abnormality. And most of the time, it's one of the chromosomes is not there, either 45 in one cell line or 46. That being the case, most of these embryos, when you analyze for PGD, they don't have one chromosome plus, one chromosome minus. So that means they don't have 46 chromosomes, one less or one more. That becomes a mosaic. So even when we do PGD, most of the time it's mosaicism. So that is also another problem in detecting abnormality. And then depending on the number of cells that you analyze, you have to make sure that it is 100% free of any of these abnormalities. Only those embryos can be transferred. So PGD can be done at the 8-cell embryos, but also since we can take only one blastome year for us to detect this abnormality, it is not feasible because of the technical problems. That being the case, nowadays we take cells from the trophoblastic cells from the blastocyst. That we can get more than few cells. And then when we analyze, you will be able to detect more abnormalities and be very sure that this particular embryo carries no such aneuploidy, but it can still carry some genetic abnormality which we cannot detect. And there is a family history, whether the mother or the father is a carrier status, then we can detect genetic abnormality based on the what are the like G6PD, hemophilia, muscular dystrophy, any of the single gene defects.
Pre-implantation genetic screening or PGS is a technique where one of the blastomeres or one of the cell is removed from the embryo, preferably a day 5 embryo, and then we try to find whether that particular embryo has a normal set of chromosomes called as euploid or abnormal sets, that is aneuploid. So once we find it is an euploid cell, then these are the better ones to be transferred. So the chances of implantation failure is much lower. But sir, in spite of doing this, we still have, when there is an euploid set of embryos which are transferred, there are still chances that the pregnancy fails. Any particular reason that you can tell us about?
You know what happens in normal situation, day 3 embryo transfer, which is normally done all over the world. But you must remember that the embryo that is put into the uterus on day 3, it has to survive for another 3-4 days for it to implant. So we are putting the embryo too early into the uterus when it's not supposed to be. That's not the natural phenomenon. Ideally, one should transfer the embryo on day 5 or day 6 or 7, nearing blastocyst stage, so that the embryo is ready for implantation. So that will be the actual milieu of the uterus where it can implant.
Now coming to the most important and one question that most of the patients come through is, whenever they undergo an IVF and on the day 3 or sometimes the patients or the couples are called back to the center and told that there has been a arrest and your embryos have not grown beyond day 2 or day 3. So sir, what do you actually mean by arrest?
The embryo, when it grows, it divides mitotically. That means 2 sets of chromosomes, that means 46 chromosomes divided into 2 and keeps multiplying like that. But when the blastomere arrest means there is a spindle problem. The cells don't divide, the chromosomes don't separate from the original 46 chromosome into 46, and the spindle fibers will degenerate, or for some reason they are not forming. So the chromosomes don't seem to separate from one cell to another. So there is an arrest, and this can happen in a single blastomere. When we look at the microscope, a lot of granulation will be there in a single blastomere, or it can happen to all the things because it is originating from its zygote. That means from the day 1 to day 3 or 4, it divides normally, but at some stage there is a spindle fiber formation. Most often it will be a chromosomal defect. That's the reason it will be a gross chromosomal error. So that means nature itself is putting an end to this embryo that is not able to cleave any further.
So whenever there is an arrest or a day 3 arrest of your embryos, that does not mean that all your embryos are going to be of poor quality and you cannot have your own baby. It's just that that particular embryo or that set of embryos were of not good quality, probably because of extreme chromosomal issues, and with some medications things can improve, and in a further cycle we can have a better quality embryos and you can have a healthy baby. So do not lose hope if there is an arrest, and kindly go for another cycle and try till you succeed. So any queries further related to this, we will come back to you with all the questions answered. Kindly ask whatever doubts you have regarding IVF or embryology, and we'll get back to you with the answers in our next session. Thank you very much.